Hello, my name's John Timperley. I'm one of the consultant cardiologists, but I'm also the clinical director for urgent care. So I look after the emergency department, ambulatory care, the admissions wards. The real reason for doing this is to try and reduce the numbers of patients going to the emergency department who actually could be managed in a more of an outpatient type setting rather than coming in acutely into the main part of the inpatient hospital. And in Northampton we started with the pathways and then moved on to having our initial small ambulatory care centre, and we managed to go from having all of our patients going through the general medical take, going in through the emergency department, having been referred from their GPs and then going into the main part of the hospital, to then taking about 100 patients a month through the unit. And those are 100 patients who are still going to come through to us, but we've avoided having to take them through multiple other steps. And also from the patient point of view, they're able to come into a outpatient type centre. They're not in the rough and tumble of the emergency department, which is very busy, and they're in a much more controlled, relaxed environment. So from the patient's point of view, they enjoy coming through, seeing their specialist, but actually being dealt with as an outpatient rather than being as an urgent inpatient being rushed through from one department to another to get them to their specialist. So what now happens is that now we've got the manning in the department now, the GP will phone up and say, we've got this urgent patient who needs to be seen. And an assessment will be made from that telephone call whether it is appropriate for them to come to the ambulatory care centre, or if they are very poorly, appropriately they would be taken straight to the emergency department. For those patients, they're unaware of that conversation, that's happened, and they will be directed to the appropriate place. So instead of being told to go to the emergency department, now they will just be told to come to the ambulatory care centre. The difference then starts there, in that once they've arrived, the flow through here is different to what we would do in the emergency department. We were looking at being able to get 400 patients per month through this department, whereas before we were looking at about 100 to 200 patients. So it's a significant improvement in the numbers, but also for the staff it is, and it's not a massive department, but it is perfectly formed and perfectly able to do the job that we need it to do. I think the friends and family test speaks for itself, in that the ambulatory care centre gets routinely very good scores because it is a nice environment, that the patient is relaxed, and we're not putting extra emotional stress on them by getting rushed into an emergency department, when in fact this is a much more appropriate place for them. And it also does mean that we can see them in a controlled manner and also look after their urgent follow-ups in the next few weeks, days, again in a very controlled manner, as opposed to trying to squeeze them into extra clinics in main outpatients, etc. We can look after our follow-ups and see, for example, a patient comes in, needs scans, we can say, yes, we'll get the scans done, and then we'll see you 2 days down the line without any problems of having to go through the booking office. We can actually manage all of that ourselves.